Welcome to FIBA FM. I'm Sriram Sulya. I host the Superhero Show in Bangalore City, 5 to 9 every day in the evening. Today, we are going to be discussing something very important, something that we should all be aware of. We need to get ourselves educated about this. We're going to be talking about stroke, brain stroke in particular. You know, stroke is a major global public health problem. In fact, in India alone, stroke is increasingly becoming the main reason for premature death as well as disability. As per World Stroke Organization, 1 out of every 4 persons has a chance of suffering a stroke in their lifetime. And that's not all. In our country, around 1.8 million people suffer a stroke, and very few people manage to reach the hospital in time. That's some serious food for thought right there. And that's why I have invited our guest on the show today. We have with us Dr. Vikram Huded. He is Head of Neurology and Senior Consultant, Interventional Neurology at Narayana Health, Bangalore. Doctor, welcome. Thank you for your time. Straight up, doctor, what is a brain stroke and how severe is the disease?
Yeah, brain is a controlling center of the human body. It needs constant supply of nutrients and oxygen, which occurs through blood. So cutting of blood supply to the brain will lead to death of brain cells every progressive minute. This is called a stroke. It could be because of two reasons. Firstly, a sudden blockage of blood vessels in the brain, commonly referred to as ischemic stroke. The second reason is bursting of blood vessels, commonly known as hemorrhagic stroke. So among these, ischemic stroke accounts for 87% of all the strokes.
Wow. Doctor, what are some of the symptoms of a stroke and how exactly can one go about recognizing it?
Some of the common warning symptoms of stroke can be remembered as B fast. B for balance problem, E for eye vision, it can be blurred or double vision. F stands for sudden facial drooping, A for arm weakness or leg weakness, S for speech disturbance, and T is time to rush to a comprehensive stroke center or a stroke ready hospital. So some of the other symptoms can be sudden severe headache, loss of balance, tingling sensation on one side. We need to identify these symptoms early because identifying and going to the hospital will prevent disability and death of an individual.
There you go. That's the abbreviation you need to remember. Be fast. And that's the time when you start noticing these symptoms. It's time to head to a stroke ready hospital. And time is of essence here. Doctor, how can a stroke be prevented as such?
Majority of strokes can be prevented, both ischemic and hemorrhagic stroke. We need to control the modifiable risk factors like eating healthy and balanced diet, controlling blood pressure, controlling diabetes, reducing cholesterol, alcohol intake. We need to stop smoking and be physically active.
And what would you say are the treatment options for a stroke?
There are two types of treatment options for ischemic stroke. Like if you reach a stroke ready hospital within 4.5 hours time, we can give a clot buster injections intravenously. With that, in some cases, the arteries will open. But if it is beyond 4.5 hours or if the big vessel of the brain is blocked, then we need to do a procedure called clot retrieval. So here, a small tube is put from the leg artery into the brain artery, and we deploy the clot retriever inside the clot and remove the clot out.
Fabulous.
And this we can do up to 24 hours time.
Okay. And no wonder, I mean, that's what I was coming to in terms of, let's discuss how important time is in all of this, because there is a lot of discussion about how time plays a crucial role during a stroke.
Yeah, so stroke is an emergency and every second counts. So when someone is having a stroke, every untreated minute causes death of 19 lakh brain cells or around 30,000 neurons every second. So 8 out of 10 people remain disabled at 3 months if not treated timely. Reaching the comprehensive stroke center or stroke ready hospital quickly is crucial for effective stroke treatment.
Right. Doctor, a recent report says that COVID-19 patients have even higher risk of a stroke. Is that true?
Yeah, see, after COVID, even in Bangalore, we are seeing a lot of strokes post-COVID. There is a research which was published in JAMA Neurology, which found that the risk of stroke post-COVID is 7.6 times greater compared to the common influenza.
Wow, it truly is incredible. And I think knowing all of this is only going to make us much more wiser and at least help us prepare as to what needs to be done. We need to be aware, we need to have ourselves educated of these situations so that we know what would be the right procedure, especially when time is of so much of importance. And that's why the term they say time is brain when it comes to a brain stroke, that we would like to emphasize as much as possible here. So you need to head to a stroke ready hospital in case of a brain stroke. Thank you for all the insights there, doctor. Fantastic ones. I'll always remember be fast as an abbreviation as well. I'm sure your words of wisdom and experience in the medical field will surely help our listeners. Let's be sure to remind and remember the health tips and practice them, prioritize our health above everything else. And this stroke day, let's promise to take care of ourselves and everyone around us. Stay hooked to Fever FM. Dr. Vikram Huded, thank you once again.
Thank you, Sriram.